Hello, everyone. Dr. Christine Smith here. I have an awesome guest for you tonight, Dr. Miles Nichols, and we are going to be talking about chronic inflammation and chronic infections and how they can affect your brain health. So I'm going to go ahead and invite him on here. And the reason that I wanted to bring him on tonight, and he was so kind to kind of join me when I asked him last minute, was because he is actually the organizer and creator of the Microbes and Mental Health Summit. So I am just pulling him up here. Let's see. Technology, 1 second. But yeah, he is a very interesting doc. He's actually a doctor of acupuncture and oriental medicine, functional medicine doctor specializing in Lyme, chronic infections, mold and toxin exposure, gut health, thyroid, and autoimmune. Hi, Dr. Nichols. How are you?
Hi there, doing well. How are you, Dr. Christine?
I'm good. Thank you so much for taking the time to do this. And thanks for doing it last minute too. I just got so many questions on the reels that I posted, and you have the really cool summit that I was telling people about coming up, and I thought who better to talk to than the person who organized it and got to speak to 50 plus different experts about this stuff. So I'm actually really excited that you're here. Why don't you take a second and kind of introduce yourself a little bit in whatever way you'd like to, and then we can get rolling.
Sure, happy to be here. And I am a functional medicine doctor focusing on chronic infections like Lyme and co-infections, as well as mold and mold toxin illness, together with gut, thyroid, and autoimmune issues. And I really am passionate about helping people to figure out what their potential is for their health, for their mental well-being, and for spiritual as well. And so I have my own history with chronic health concerns, and I have become passionate about helping people to overcome those as well as living a full, loving, healthy life.
Beautiful. Wonderfully said. Thank you. So, I guess one of the places that we can start is what does the recent research suggest about some of the top categories for mental health issues? And when we take things like mold or toxin exposure into consideration, which I don't think a lot of people really think about and know, and how it can affect their mental health into consideration, like how does that change treatment approach? Because I know for myself, like when I had experienced my own mold exposure, yeah, it really messed with my mood and my ability to feel joy and brain fog. And the way that I had kind of described it is it's kind of like living in your head with this big empty hall. And it's like all the things that are supposed to fill it, your thoughts, your emotions, your ability to like complete a procedure, it's just empty. And like it's this void of thought, of mind and spirit. And it took me a long time to be able to articulate that. But I want to put it that way because I want to give empathy to anyone going through it because it can be really tough. So yeah, I'd love to hear your thoughts on that.
And I hope that you're bringing that up because I really want to make sure to expand beyond the traditional, maybe way that a lot of people think about mental health of anxiety, depression, PTSD, these diagnostic labels, because major depressive disorder, that's a huge deal. Anxiety disorders are a big deal. Mood disorders are a big deal, but there's a spectrum. There's a spectrum that goes a lot beyond the actual diagnosed disorders. And if we take a spectrum of trauma, for example, everyone is on that spectrum somewhere. And uh, they may not never get a diagnosis of PTSD or post-traumatic stress disorder. And same thing with anxiety, with depression, with even more subtle things like brain fog or a challenge with focusing and concentrating, whether there's a diagnosis of ADHD or not. A broader context on mental health can help, one, get rid of some of the stigma because everyone experiences it, every single person to varying degrees. And it's just a matter of degree. It's a matter of where and how a person experiences it. It's a matter of how impactful it is to their personal life and their quality of life as well as to the functional ability for them to be able to do what they want to do and be able to be the kind of person they want to be, to show up in relationships, to be able to go and have the energy to do the passion projects and creative pursuits that people want to do. That's really the key here. And it's sad because even if we just take the diagnostic labels, we have about over 20%, about 21% who of US adults in America who in a 12-month period will have at least one of the mental health diagnoses. And if we look at adolescents, it's about 17% in a 12-month period. But if we look at a lifetime prevalence of adolescents today, it's almost 50%. It's 49.5% have struggled with a mental health disorder at some point in their life, and over 1 in 5, over 20%, a severe mental disorder. So when we say disorder, we're actually talking about interference in the functioning of life and or the quality of life to a significant degree. And when we talk about a severe mental disorder, we're talking about something that is threatening relationships, maybe the person's own well-being, maybe the person's ability to maintain a job or a relationship. So that's what we're talking about there.
Yeah, I think that was really wonderfully stated. And I'm glad that you brought up the idea of like adolescence because I think it's a really big thing that sometimes gets overlooked. And I think addressing it at that age is really important because it's also when brain development is happening. And so if you just immediately only turn to like a very chemical solution, it can actually affect brain development in certain ways. So it's really nice to have some of these natural resources and just be able to think about it from more of like a lifestyle component. Um, so I know we're talking about like a variety of different things, and feel free to kind of tell people like what's going to be on the summit that's coming, because I know you spent a really long time and a lot of work putting this together and collecting some of the greatest minds around on these kinds of topics. And it's things around chronic infection, and that can include things like having mold in your home, which is way more common than people realize, or even if you like go somewhere for a vacation and you just stay in that room that's like a little bit musty and kind of smells weird. Or I had someone comment and like, I think it's actually in the air conditioning of my car because every time the air conditioner turns on, I get this like weird musty smell and you don't always smell it. Like I had no idea that I had mold in my home because it was in a closet that was locked that like I don't access. And so it can just be hidden. Someone else commented that their son had been living in like a basement during college and it was just kind of like a damp basement. And this, I don't know, in Colorado, like Colorado's a super dry place. This can happen in dry places. So it can just happen from weird times. And then the summit also addresses other infections, things like Lyme and just other chronic infections, and then these infections can play on each other and create this like horrible storm of chronic inflammation. So I'd love if you could touch a little bit on those and just like why it can be such a problem and how it can slowly tank your health in a very sneaky way.
Yeah, I'd love to. I'll touch on what the research says about the prevalence of Lyme, about the prevalence of mold and mold toxin issues. It's actually quite alarming what it says about that in terms of how many people are exposed and how many people might have chronic health concerns as a result of that. Before I do that, I'll jump back and take a step back to a bigger picture on what are the causes of mental health concerns. And the popular notion around this has actually largely been disproven in research, and a lot of people don't understand this. So a lot of people think, oh, it's a neurochemical imbalance. That's what the cause of these mental health disorders. If I'm depressed, it's because maybe serotonin's a little low. That's why there are these drugs called selective serotonin reuptake inhibitors, or SSRIs, that are used for depression. Now, one thing is just briefly the context, and if you're interested in this, it goes into a lot more detail in the summit. You'll understand more about this. But back in the 1960s, there were studies on tryptophan, which is an amino acid, and there were some cultures that had low tryptophan diets and higher incidence of depression. That's where this whole idea started. And then later, when SSRI medications came out, they showed efficacy better than placebo for depression. So they figured, oh, it must be serotonin that is causing depression in at least some people. And the research didn't actually perform that well, but it did better than placebo, so it was thought to be a big mechanism of action. And more recent research, a paper in 2022 came out that was an umbrella paper that looked at all these different research on tryptophan depletion and serotonin depletion and genetics related to serotonin and depression. And their conclusion was there is no good evidence that serotonin and depression are linked. There's no good evidence that a depletion of serotonin causes depression. And that calls into question the whole notion of neurochemical imbalance being a primary cause for mental health concerns. And if not neurochemical imbalance, then what is it? And that's the question we're investigating on the summit.
I also want to just remind people, because not everybody knows this, that a huge amount of your neurotransmitters are related to your gut health. And if your gut is not healthy, which now let's just think about like our average American diet, if your gut is not healthy, your neurotransmitters are also going to be out of order. And so that is something that is finally starting to come to light more. And I'm really, really glad. I know you guys addressed that on the summit as well. But as he's talking about this, gut has a lot to do with serotonin as well as other neurotransmitters. So just wanted to toss that in.
Absolutely. So even if neurochemical imbalance were a cause of mental health, then things like gut dysfunction would be playing a big role in it. And yet it doesn't appear that neurochemical imbalance is a big role in mental health, at least not in the way that it was thought to be. So that begs the question, why are SSRIs effective for some people, and what are the causes if not neurochemical imbalance? And then with whatever those causes or those mechanisms of how depression and anxiety and other mental health disorders arise, then what's causing those mechanisms to occur? These are the questions we're really exploring in depth in the summit. And to give a brief overview of some of that, I can't get into the depth here, but to give a brief overview of some of it is basically that there's good evidence that inflammation in the brain, or systemic inflammation, we call this sometimes neuroinflammation, plays a big role in mental health conditions. And one of the mechanisms that SSRIs or antidepressant medications actually may work that's not related to serotonin at all is they do and can lower neuroinflammation in some people. So this may be part of the reason why they're effective that's unrelated to serotonin whatsoever. And if neuroinflammation plays a big role in mental health dysfunction, then what else causes neuroinflammation? And when we look at that, we can see gut dysfunction does lead to, for example, intestinal permeability. If the gut, dysbiosis, overgrowth, infection in the gut can lead to leaky gut, or intestinal permeability can lead to this flood of bacteria into the bloodstream. And gram-negative bacteria has something on the cell wall called lipopolysaccharide, or LPS. That's considered to be an endotoxin, and it creates systemic inflammation, including neuroinflammation. So we can see how a gut dysfunction issue can lead to bacteria from the gut into the bloodstream, can lead to systemic inflammation from the endotoxin on the cell wall of that bacteria called LPS, can lead to neuroinflammation, can lead to mental health dysfunction. And there's actually quite a surprising link between, for example, constipation, type irritable bowel syndrome, and anxiety rates being dramatically higher than in the general population, and depression rates being dramatically higher. So those with irritable bowel syndrome or digestive issues have a much higher incidence of depression and anxiety than those who don't have digestive disturbance, which does point that there may be a link. That's a correlation, not causation, but there are causative links that we can see through leaky gut, intestinal permeability, and through other methods. There's a study that looks at the vagal nerve connection between the gut and the brain, and when they cut the vagal nerve, all of a sudden, the LPS doesn't make a difference anymore, the endotoxin doesn't make a difference in brain dysfunction anymore, and you don't get the benefits of certain probiotics in the gut signaling the brain. So it's very interesting, and there's a big link between gut and brain as one category. A second category are chronic infections, that we do see that chronic infections can cause neuroinflammation or a different mechanism of an actual autoimmune process against the brain. I won't go into the details of how that happens, but infections very clearly can cause the body to initiate its own immune attack. It's trying to attack the infections, but inadvertently attacking brain structure and tissue, including dopamine receptors, including receptors that can change neurochemicals in the brain, and including brain structures that are involved in brain function. And then we can see onset of Alzheimer's, dementia, mental health dysfunction. Many different issues occur as a result of chronic and systemic infections, including things like Epstein-Barr virus, Lyme, Bartonella, Babesia, and many others that are potentially initiators of this kind of a process that can lead to mental health concerns. And even if we just zoom in on one of those, Lyme disease, for example, one of the most recent research papers that came out showed 14.5%, or about 1 in 7, of the world population is seropositive, meaning lab test blood result positive for Lyme. And a lot of people don't understand that. And even people who don't live in Lyme endemic areas still have some chance of chronic Lyme. So that's very misunderstood and underappreciated. And then if we go into another category and we zoom in on not an infection, but we zoom in on the toxin byproduct of microbes. So we have these microbes, these mycotoxins, that are a byproduct of mold spores. And the mold spores can get in the air because the building is damaged. And by the way, the stats on this are the EPA estimates between a quarter to a half of American homes have damp conditions that could foster mold growth. And when mold grows, then those spores can be breathed in. And the lungs can filter stuff out, but the mycotoxins on those spores are so small they can get into the bloodstream. When they get into the bloodstream, then they can what's called bioaccumulate in tissue. Sometimes it's fat tissue, sometimes it's actual organs or brain tissue. This happens in about 1 in 4 individuals have a genetic predisposition. That means their immune system doesn't adequately recognize these mycotoxins as a threat and get rid of them. So they tend to bioaccumulate and cause their own systemic chronic inflammatory response that can also lead to neuroinflammation, that can also initiate this autoimmune process against brain tissue, that can lead to brain dysfunction issues and mental health issues. So mold, Lyme, other chronic infections, other toxic byproducts of microbial infections, and gut dysfunction are all significant causes of mental health that is supported in research. And if we can start to look at those, how do we test for those? How do we treat those? Now we're looking at new causes and solutions that aren't really investigated deeply today when someone's struggling with a mental health or brain issue.
That was an excellent summary, and you brought up so many important points. And I'm so glad that you brought up basically like the leaky gut component. And anyone who watches my channel regularly, like it's tied to so many things. And I try really hard on here to make sure that people understand that like we are holistic creatures and none of our organs are separate. Like they all work as a system. So if something starts to be dysfunctional, the other ones are usually affected. So if you start to say you have mold in your home and you start to have some of this mycotoxin exposure, those mycotoxins can affect different people in different ways, but ultimately it causes tissue damage. And then when we have tissue damage, we have an inflammatory response, depending on our genetics, but usually have an inflammatory response, and that can create a systemic inflammatory response, which can then perpetuate things like leaky gut, which can then perpetuate things like LPS and toxin exposure, and what is called subclinical endotoxemia, which is basically like accidentally being poisoned from the inside. And then if you already have, Lyme or something, then these things can perpetuate those other things. And I want to bring up the point because it's really easy to listen to this stuff and get super freaked out. And I just want to bring up the point for people that like we've been living with this stuff for long periods of time. Like our bodies are incredible and totally amazing at healing themselves. And so just remember this, like remember your body's capacity to heal when you give it the right resources. But just know that if like all of a sudden your health kind of tanks out of nowhere, it's probably not out of nowhere. It's probably that you were dealing with something for a while, like maybe you had like a hidden Lyme infection that your body was like keeping under wraps and it was okay, but then you moved into a new home and there happened to be some mold there that you didn't know about. And then you started to feel really crummy. And then all of a sudden you started to develop some weird food sensitivities. And then let's say you just like get an offender bender because that's life. And then all of a sudden, like your health just plummets and you're super fatigued and you don't know what's going on and you're having some like mental stuff, or maybe you're having some like autoimmune tendencies, but the lab work doesn't really know what's going on and like conventional care says you're fine. This is how this can happen to your average person. And when you start to take care of the infections and you take care of the exposures and you take care of your body in the right way, you can absolutely make your way through this and come back to a state of health. It's just this knowledge and the education around this and knowing the right people to work with to be able to overcome this is what's so important. And this is why I do this stuff and why Dr. Miles spent so long putting the summit together. So I know it can get really scary listening to this stuff, but I also want to remind you that like your body is designed to heal, and sometimes we just have to know what's going on and provide the right education so that you don't get lost in the sea of the compounding effect of all the things that can happen in life. So I loved everything that you were saying. And I know I just kind of brought up the idea of like, why do these infections have the capacity to kind of perpetuate each other? And like, how does that work? And I know you've seen a lot of this in your office, so I'd love to hear your thoughts.
Well, first it helps to bring up a concept, and thank you, by the way, for talking about the fact of that the human organism is resilient. We can
Yes.
deal with some stress, we can deal with infections. There are a number of people who are walking around with chronic Lyme disease who don't even know they have it, who are functioning beautifully, and there are people who are walking around with a biotoxin accumulation from mold and living in mold who are thriving. So it's a little more complex than are you exposed to these issues. There's a concept called allostatic load, and this concept is looking at how much, what's our threshold for capacity to remain resilient? You know, how much can you tolerate before you get out of balance or before chronic inflammation sets in? Your body has the capacity to regulate to a degree. And it's kind of like, and I also want to make sure that we're not discounting or discrediting emotional trauma, adverse childhood experiences. These are big
Yes.
issues. If we look at the adverse childhood experiences study, some of the ACEs research, we can see that if even in childhood, if there have even been two significant adverse childhood experiences, which for many people there have been more than two. These are things like parents divorcing, addiction, someone going to jail, someone dying, many aspects, abuse, uh, many aspects that are kind of horrible to talk about or think about, but that do happen. They happen regularly. Unfortunately, the data on ACEs is that these are very, very common things. And we see that predisposes people to higher incidence of autoimmunity, higher incidence of substance abuse, higher incidence of diseases like heart disease even. So what that means is that we have this capacity for handling so much, and that's physical, that's emotional, that's spiritual. There's this capacity to handle so much. If that capacity is exceeded, we hit what's called allostatic load. Continuously, day in and day out, people are accumulating and getting rid of some of that load. Every day as you eat healthy, maybe you're actually reducing some of that load because the body is initiating healing responses. The default of the body when it's getting the right inputs is actually to heal, to reduce these it has mechanisms for detoxification, mechanisms for rebuilding tissue, mechanisms for repairing and regenerating. The body has those capacities when the inputs are dialed. And then when there's sleep deficit or deficiency, when there's excessive amounts of stress, when there are traumatic experiences, when there's exposure to certain infections, when there's accumulation of toxin like from mold, these are adding to the burden. These are adding to that allostatic load. So let's imagine we have a threshold here, and in childhood we got a big stress and that was significant. And then maybe we spent a lot of time doing meditation, we kind of reduced that, and then maybe we got exposure to an infection, and then maybe we got some toxin exposure, and then maybe we lived in a moldy home, and now we're over that threshold. And now all of a sudden the infection that wasn't a big deal before because we were below that threshold, now it takes hold. The immune system is dipped. That inflammation is causing immuno changes that are creating that environment for that infection to get worse and worse. And now we're seeing this snowballing where there's a vicious cycle, and that vicious cycle is maybe the gut is permeable and you're getting continually this endotoxin and maybe this infection that was chronic, not but the immune system was managing it okay, is now reactivating and becoming a bigger issue and creating its own neuroinflammation and systemic inflammatory picture. And then the toxins that have accumulated that weren't enough to cause problems are now starting to actually impact tissue function, impact inflammation, and now we're seeing brain changes. We're seeing the neurotrophic factors in the brain drop. We're seeing forgetfulness and difficulty concentrating and brain fog set in, and a person is starting to feel a little depressed and starting to feel anxious when they didn't used to feel anxious. And there's actually good data about post-infectious onset of anxiety, of depression, of OCD. We see, and this happens in children too. They'll get strep throat, and then all of a sudden, within 3 months to a year after that strep throat infection, they'll start to have behavioral changes. And they'll start to get diagnosed sometimes with ADHD, with OCD, with eating disorders, with food sensitivities that keep increasing. And it was resultant because originally that infection created a cross-reactive autoimmunity against brain tissue. That slow destruction of brain tissue led to these behavior changes. And then that chronic neuroinflammatory state led to worsening those changes. Unfortunately, child usually gets medicated and doesn't get appropriate testing and solutions related to infections, toxin exposure, gut dysfunction, and these underlying issues that have built up. So we have allostatic load, and throughout our life, things are going up and down. And as we do things like pay attention to our sleep, our stress, our diet, and our environment, and make those things as pure and clean and healthy as possible, it goes down. And as we're exposed to inevitably the stressors in life and the issues and struggles, it can go up. And depending on how we relate to those, depending on what we do about them, depending on many different variables that we won't be able to get into here, but will depend on where that threshold is. That threshold actually can go up and down, and where the burden is. That burden can go up and down. Lower the threshold, higher the burden, more likely there is to be chronic infection and chronic disease.
Yep. Absolutely. And I want to point out to people like everything that he was just talking about is why different things work at different times for different people, and why you might be fine with like a certain type of diet at one point in your life. And then all of a sudden you have to be way more careful and you're just like much more sensitive at a different time in your life. And then you become more okay again. And then you get sensitive again. And it's like our bodies are this dynamic moving system. So if you are dealing with a allostatic load that is near capacity, maybe because you're stressed out at work and you're stressed out at home and you also just got injured, and maybe you also happen to have some kind of environmental exposure, like say that you were traveling for work and you stayed in that weird hotel room, right? And then you're just not feeling the same afterwards. That's a time where you're going to have to be a lot more careful with your diet. Or if you run into like the situation I ran into where I was allergic to a lot of foods and supplements after a mold exposure, the only thing I could do to really get my inflammation down was really deep meditation. And that's why I got super into meditation. And that is the thing that like finally broke the cascade for me so that I could start to bring like vitamins and nutrition back into my life. But everybody's different and they're going to be at different places and your body's going to need different things. So that's why I like to do this kind of education, and why Dr. Miles puts so much time into creating a summit like this, is so that you can learn about your body and your own physiology and make the decisions that are right for you and know the right questions to ask whatever practitioner you're working with so that you can figure out what's right for you. So I like people to know like it's different for different people at different times for exactly everything he was just talking about. Oh, well, yeah, and if you have any follow-up thoughts, please go for it. But my next question for you, whenever you feel ready, is I'd love if you could talk about some of the key takeaways you had from interviewing the dozens of experts on the summit, because I'm sure you had some fascinating conversations.
Yeah, absolutely. The summit's been fantastic. I just really felt in my practice, like people weren't coming in for mental health or brain issues, but their mental health and brain issues were getting better. And that surprised me. I was thinking, why is this that people are like, I came in because I was fatigued and my energy is better, but I'm not anxious anymore. Weird. And then someone else said, I came in because I felt like my chronic pain was debilitating, and I don't know, maybe my depression was related to the pain somehow, but I'm not depressed anymore. I'm feeling so much better, and so that just started to happen so often that I thought, there's a lot more to it than simply, and I mean, I'm grateful. I'm grateful for counseling. I'm grateful for psychiatric medications. I think these are really helpful for many people, appropriate, and pair well with the functional work too.
It's about
And
integrating everything.
yeah, and I've realized that for those who are investigating those things and getting stuck, often there are some of these other leverage points. And I like that you bring in these leverage points. And one of the takeaways I got from interviewing all these experts are that, one, there are many different ways of perceiving the causes and solutions for mental health and brain dysfunction. And two, there are some essential things that stand out as commonalities in the perception of many of these people, because many of these experts will speak to varying aspects of diet, of sleep, of stress, of breath work, of temperature like cold exposure, of things like supplementation, things like certain nutrients, certain herbs, I mean, a lot of different things. Many of them boil down to dialing in gut function, reducing the burden of biotoxin accumulation, reducing the burden of the chronic infectious load, and modulating the immune system function. If we're going to look at the things that were coming up over and over again, immune function, gut function, infections, toxins, and mitochondrial function would be these things that just keep coming up over and over and over again in relation to these mental health and brain disorders. And then on the mind-body side, the things that come up over and over again are breath work and cold exposure, meditation practice, and brain retraining practices that are working on the limbic system of the charge and activation around things. And these things also, the vagus nerve, the limbic system, and the inflammatory response and the immune and nervous system function and ways to modulate those through mind-body practices kept coming up over and over again in these expert talks. And so what that brings me to is feeling like, okay, if we can look at and address gut dysbiosis, toxin accumulation, infectious load, immune function, mitochondrial function, nervous system regulation, limbic system dysregulation, and vagus nerve function, we're really, really getting now a very comprehensive approach to looking at mental health and brain dysfunction. And I know that sounds like a lot, but that's boiling it down. That's boiling a lot of things down to some categories that are a little more digestible. And
And
yeah.
actionable.
hmm Yeah,
Yep.
digestible and actionable. So in boiling down to those categories, now we can look at a core set of tests and treatments and practices that can be done in order to get to some of the root causes and solutions related to mental health and brain dysfunction.
That was perfect and actually leads me right into my next question. So thank you. Basically, like there's two more things I kind of want to address, which is like what to do, right? Because we just talked about all the scary stuff. Now I want to talk about like how you can actually approach this. And you were just talking about like testing and how to know when things are there. So I'd love if you could talk about your approach to like one, like how do you know if it's in your environment type of testing, and two, how do you know if it's in your body type of testing? And then we can get into like questions to ask when you have someone coming in and remediating your home. And I'm actually going through that right now. So it's like I just want to give empathy to anybody going through it because it's a process, but I also want you to know how resilient you are because I know it's really easy to get freaked out around this stuff. And like I'm literally sitting in the room that's being remediated right now. And so it's, you'll be okay. Like it's gonna be okay. So let's talk about some of the what can you do.
Yeah, I mean, the first thing, if people aren't already, if people are, it's, when someone is looking at advanced diagnostics, lab tests, and fancy solutions, and the first thing I ask is, what is your diet like? What is your sleep like? What is your activity level like? If someone's on standard American diet, sedentary lifestyle, I mean, that these are the low-hanging fruit that go after these first. If you're so, I mean, the first thing is, educate yourself and work on diet and lifestyle. That's just key, absolutely key. Now, I happen to be the kind of person who people come to me after they've done 3 or 4 elimination reintroduction diets. They've been on the dietary path for many years. They've been doing they've done sleep hygiene, they've optimized several things, and now they're still struggling. Now, this is a different person and a different thing that we need to go to. But I'll say for the person who's just getting started, educate yourself about the basics of diet and lifestyle and work on that aspect first and do some of the basic labs like even that your normal doctor will run, things like CBC, CMP, TSH for thyroid function, and some of the metabolic markers like glucose, hemoglobin A1C, a lipid panel. If your triglycerides are elevated, that's a sign maybe fatty liver is forming. Maybe you need to reduce carbohydrate a little bit. If your hemoglobin A1C or your glucose are getting elevated, then doing some metabolic work are important. And then add some extra things, a few extra things like uric acid level is another metabolic dysfunction sign. We have a whole talk by Dr. David Perlmutter that's going to talk a lot about uric acid and how that can be a sign of metabolic dysfunction and monitor that as well. Add in a fasting insulin level that can show earlier signs of metabolic dysfunction. Add a free T3 and thyroid antibodies onto the thyroid panel. So, we can start adding little bits and pieces on as someone is layering a little deeper. Now, if you're chronically ill, if you've done all the basics, and you're really looking for a comprehensive approach and you're ready to seriously invest in your changing your life significantly, then we look at more advanced diagnostic testing. And that is doing things like gut dysfunction testing, so small intestinal bacterial overgrowth breath test, a comprehensive stool analysis, looking for infections, looking for bacteria, fungal issues, or dysbiotic bacteria that can be causing gut problems. We look for a Lyme and co-infections, tick-borne chronic infections panel. We look at inflammatory markers related to mold toxin illness and exposure. And we test the home for the dust in the home, a Hertzsmear or an ERMI test for looking for the toxic forms of mold in the home, in the car, in the workplace, in the environment, and help to assess that environment for those toxins that can accumulate and cause issues. And then we do a comprehensive nutrient panel, often something like the Nutra eval by Genova is a good one. There are a few good ones that look at mitochondrial function, methylation, nutrient status, metals, and a few other things that can establish where we might be seeing issues form from a mitochondrial and nutrient perspective. And if we're going to do that kind of approach, it gets a little more complicated, but we'll do just a comprehensive blood panel, we'll do tick-borne co-infections panel, we'll do 1 or 2 gut tests, and then we'll look at nutrients and methylation function. Now that starts to give a very wide swath. If we want to be a little more down to earth practical for people on a place to start with what your conventional doctor is willing to order and ask for a couple add-ons like uric acid, fasting insulin, hemoglobin A1C, free T3, and thyroid antibodies, and then do a visual contrast sensitivity test if you're suspecting mold issues. That online is very inexpensive and easy to do. It's vcstest.com, and there are visual changes that occur when you're exposed to biotoxin and it accumulates. And that's a really good first screen for getting started and seeing if toxin accumulation from either environmental toxins or internal infectious produced toxins might be creating or causing issues for you. Those are some great places to start.
That was awesome. And this will be recorded, so if you guys need to go back and listen to those, you can. And for anyone who is, a little bit less familiar with some of the lab terminology, I just want to kind of recap what he was talking about for you. So the basic tests that your normal practitioner runs for like your annual checkup are a really great place to start. Um, some of the things to add on to that. So when he's talking about like thyroid antibodies, that's like checking if you have an autoimmune reaction to your thyroid. So if you're starting to like feel a lot of fatigue, or you're actually like unable to sleep, which is like the opposite effect, or having some of that, that can be related to that. And it's something that often doesn't get checked. So you can just ask to, add thyroid antibodies on to your normal thyroid test. And then when we're talking about like the stool test, that's checking for the gut dysbiosis that we were talking about and looking for um, and when I say dysbiosis, it's like an imbalance of microbes in the gut. We're supposed to have microbes, like they live there, they help us out in a lot of ways. But if certain levels get too high or certain levels get too low, it can start to create a really weird chemistry. And they also respond to like the other systems in our body and the other chemistry that we produce. So it's a very synergistic relationship. And if they get off, we can just kind of get off. And a lot of people have never had something like that run, so that's an incredibly good place to start. Now, when it comes to like dealing with chronic inflammation from infections, we can do things, like tests that look in the urine for mycotoxins and stuff like that. But depending on the genetics that he was mentioning earlier, you might have a completely different reaction than somebody else with the exact same levels. So it can actually be really important to check some of these blood markers, things like MMP9 and complement factor and other large sciencey words that basically look for if you're having like a really like a chronic inflammatory reaction or something called like SIRS, chronic inflammatory reaction syndrome. Sorry, I'm having a brain
Response
fart.
response
Response
syndrome. Yep.
syndrome. Thank you. So, that's just like different things that you can check for. And there's so many different ways that we can test these things, but it's really dependent on you and what's going on with you, which is why it can be really helpful to work with a practitioner who does continuing education in this stuff outside of just medical school and their residency, or whatever their training was, because it's a lot of continuing education and dedicating yourself to studying these things to really be able to dive into it in a deeper way. But yes, I think that was awesome. The visual test is also a really cool place to start. But also, I'm just going to go back. Don't freak yourself out too much. Just take everything one step at a time and don't overwhelm yourself, because if you are having brain reactions to this kind of thing, it's really easy to get stuck in like a horrible cycle of anxiety and overwhelm. So that is why we do this, is so that you can have education, you can have resources. The summit that we keep talking about, there's a link for it in my bio. So if you, or Dr. Miles's bio as well. So if you want to go to either of our names, you can click that, click the link in our bio. It'll take you right to the information for the summit. It's free to sign up right now. And then you'll just have access to all of these resources. So we talked about kind of how to discover it in your body. And then I'd like to talk about how to discover it in your home, because a lot of people asked me that in the comments. They're like, well, how do I test for it? How do I do this? And it's like, you can kind of test for it, but sometimes it's really helpful to work with a company that specializes in knowing what to look for. And then in addition to that, I'd like to go into like things to ask about remediation, because I know I want to respect your time and I usually try to keep these to about an hour so I don't overwhelm people. We have like 15 minutes left. So, but yeah, I'd love to talk about things to ask for in remediations, and then just like, yeah, how you can start getting your life back and what you think are some of the most important things for people to know.
When it comes to the environment, there are many aspects, and mold is one. There's also things that people should keep in mind, and I think do oftentimes keep in mind, but not always, and that's what products are you using in and on your skin? What cleaning products are you using? What are you exposing yourself to in those ways too? So it's important to understand that the environmental exposures are significant. Environmental exposures are responsible for most asthma. That's very much agreed upon. Many allergies, many other aspects of chemical sensitivities, and certain things are related largely to environmental exposures. Now, when it comes to mold and mold illness, in looking at and assessing the environment, there are a couple basic things to understand. One is that use common sense. So look for some obvious signs. Discolorations of wood are generally going to be occurring from water damage. If there's any water damage anywhere, that then should that can lead to an understanding that mold could be growing. It takes mold a little bit of time to grow, but it's not that long. Some molds can start growing in 24 hours of dampness, 48 hours of dampness. Other molds might take a couple of weeks of dampness to start to grow. But once it starts to grow, drying it out is inadequate. So if anyone has had a history of a basement flood, of a leak, of something that occurred that made damp conditions for more than a day, then removal and replacement of those water damaged porous materials like drywall, insulation, carpeting, etc., is absolutely required to get rid of the mold spores. Drying it out is not appropriate because drying it out may stop the growth, but it doesn't kill the infection itself or the spores themselves. And things like bleach and other harsh chemicals can actually even aggravate and exacerbate the release of spores. So it's really important to removal and replacement of water damaged materials. And many building issues that have occurred have not adequately done appropriate remediation. They've dried it out instead of removal and replace. So that's one thing, is take a history. What are the historic water events that have occurred?
I
And
also
has there been removal and replacement?
I also want to just say other things you can look for really quick. So we talked about like the wood discoloration, bubbling paint. That's another one that people don't know about. Warped floorboards, like warped baseboards along the wall. And if you have any kind of organic material in a room that you suspect may have had water damage, or even like in your water heater room, like things like cardboard boxes, which a lot of people store in like crawl spaces or a mattress or luggage or anything like that. So just want to like let you know the things that you can kind of keep your eye out on.
And some people think, oh, well, there was a problem in the basement, but I don't live in the basement. That's not a big deal. But what happens is the air flows through usually the HVAC system where it's pulling the air in and circulating it through the whole home. So those spores are actually circulating, are being breathed in. So yeah, unfortunately, unless it's an isolated space that has no airflow, which is very rare in buildings, sometimes office buildings have different HVACs for different floors. So you could be okay if you're in an office building on a different floor than the water event occurred. But in a home in general, if a water event occurred anywhere in that home, the air flows generally between the entire home. So looking at attic and basement and looking places that may have more likelihood for any discoloration or staining on wood, on roofs, on floors, on the baseboard, the bubbling paint, like Dr. Christine mentioned, all of these are really important things to look at. And opening drawers, and cabinets and looking under the sinks in the kitchen and the bathrooms. And bathrooms are notorious because people don't turn on the vent fan for 20 minutes after taking a shower or a bath. And that leads to a damp condition. And that damp condition, and especially damp condition and then close the door and don't turn the vent fan on, now you're asking for some mold growth eventually over time, especially if you're in a family where multiple people are showering. Now you're really looking at a situation where it's very likely that some mold growth will start on maybe the ceiling in there because the humidity rising, maybe on the grout of in between the tiles. And so take a look at discoloration in the bathroom and install a vent fan and make sure that it's being used. Some people even will wire that vent fan to the light switch so that when you turn on the light, the vent fan turns on, just because, it's sometimes hard to train the whole family to understand and take this seriously. So those are some other small ideas for people.
Awesome. Thank you. And I want to make sure, I know a couple people had asked questions, and I want to make sure to answer questions. So most of the questions were more about like specific symptoms, like when it comes to vision, like worrying about eye floaters and blurry vision, or can, Lyme or mold cause gallbladder issues or digestive issues, and chemical exposure resulting in vertigo, stuff like that. So I'm just going to tie it back to everything that we've been talking about, right? Because everybody is probably going to have some slightly different reaction. My answer to most of those is like, I'm going to say likely. Like, it's possible that it could be involved because everyone and our physiology tends to react in different ways depending on kind of where your allostatic load is at and what areas of your body have been stressed before. It's also possible that it's not tied to an environmental exposure and it's tied to something else. So don't like freak yourself out. Just know that we can't really answer those specific symptom questions online. However, that is exactly why he made the summit, and they'll be going into a lot of the science behind a variety of things, and that's why there's different speakers talking on different subjects. And so that would be a really good place to explore those specific questions, but I wanted to make sure to address them. Um, okay, I think that covers a lot of stuff. And then I guess if someone is looking to get their home inspected or remediate their home, what is something that they can like Google search in their area to find the right kind of company?
So, so in terms of getting your home checked out, there are some professionals that are indoor environmental professionals, and there are certifications that can be helpful in knowing you're dealing with someone who has good training. And so if you're looking for, first you can do your own assessment, then there are some tests that you can do on your own too, but many times it is better to get an environmental professional to come on board. If you are doing a test yourself, the HERTSME or ERMI test are good ones to collect dust and send the dust in, and that can sometimes tell you if it's worthwhile to have a more high quality professional come in and do an assessment. And it gets a little complicated when you're trying to find an indoor environmental professional. The abbreviation for that is IEP, an indoor environmental professional. And it's good to look for people who have certifications, professional certifications, good training, and who are knowledgeable about ideally the health impacts of mold illness. And that gets hard to find, unfortunately, because many of them are more educated about the building and less educated about the health impacts. And that can lead, unfortunately, to them treating the building like they would treat it for someone who wasn't having a health impact. And so it's good to either have a clinician who can team together with your indoor environmental professional, or to be able to have a someone who's advising that indoor environmental professional about health effects, or someone who really already understands that. So looking for indoor environmental professionals who've gotten good reviews, who have certifications, um, those are going to be some of your best bets for looking at someone to come inspect your home. And you may want to get more than one inspection before looking at remediation or moving.
Definitely. And there's a lot of good books out there too that you guys can check out. So, if you just start looking up books related to like mold exposure and like how to clean your home, you can learn a lot of things that you can do on your own. And sometimes it's much less expensive to clean yourself. It's just knowing how to do it. You can also buy something like a HEPA vacuum and a HEPA filter and different kinds of air filters that help to filter your air. So, just different things you can investigate. But I just want to say thank you so much for taking the time to do this. And I guess if you have any kind of closing thoughts or things that you'd want people to know, and then also where, if they are curious about working with you, if they want to work with a practitioner, how can they find you? And then regarding the Microbes and Mental Health Summit, I think probably the easiest place is you guys can just click my name and then go to the link in my bio and it'll just take you right to the page. And there's also like 4 or 5 free ebooks that come with the summit. So that link is there as well, and you can definitely check out the ebooks too.
So in terms of takeaways, last point summary, I'll just circle back to mental health and brain dysfunction are very common. If we put them on a spectrum, they include almost everyone. If we classify them as disorders that are significantly getting in the way of a person's day-to-day life experience and functioning, it's still affecting probably at least 1 in 5, if not more. And as people age, it's more and more, especially as brain dysfunction goes. And even for those who are healthy, to prevent or reduce brain aging and to optimize brain function are incredibly important and interesting, because if everyone's brain will start to deteriorate over age without looking at it and intervening. And so and we have Alzheimer's, we have dementia, we have cognitive decline issues as significant players today that are on the rise. Between 2000 and 2019, cardiovascular deaths went down by about 7%. Alzheimer's deaths went up by 145%. And since COVID, Alzheimer's and cognitive decline have gone up, mental health has gone up. So a lot of these stats are old and even worse today. So this is a serious epidemic. It's something to take seriously. And several things that you can do on your own are take an assessment, an honest self-assessment about what are the things that you're doing that you know that are impacting your health and your mental health and your brain health in negative ways. It's not about judgment. Everyone does things that are maybe coping mechanisms, maybe they're serving a purpose. But take an honest self-assessment. Take a look at that. Take a look at what you're doing that's not serving that. And then take an honest assessment at how important is your mental health, how important is your physical health, how important is your brain health, and start to take a look at that, and take a look at the things that you are doing that are good for your brain, good for your mood, good for your health. Celebrate that. Celebrate yourself for taking steps to further that. And look at the low-hanging fruit. Look at the things you can start with that are free. Do some dietary change. Do some work on your sleep. Work on your stress. Work on doing a daily meditation practice, doing some breath work, doing some cold exposure. In the summit, we interviewed Wim Hof, who's got free breath work that's shown to reduce inflammation and improve mood in research over and over again. So do some of these things that are freely available. Start getting those things dialed in. And if you're still struggling, seek help. It's okay. It's not a problem. We're all in this boat, you know. I am, Dr. Christina is, all of us are in it together. And it is absolutely okay. I mean, I want, just like an Olympic athlete wants a coach, even though they're at the top of their game, no matter how far I am along with my mental health, with my brain health, with my physical health, I still want mentors. I still want a coach. I still want to work on it personally. I want to optimize the function as best as I possibly can and live as full and profound and fun and enjoyable a life experience as I can. And I encourage you to do the same, to take that attitude, to work towards greater and greater brain function rather than looking at just trying to prevent issues. Because issues, if they're occurring, do address them, and a proactive approach is a lot easier and more effective in most cases. And if you want additional education, educate yourself about this, go to the summit. It's free. And if you want to work with me in the clinic, if you want to look at what that means, what that's offering, then medicinewithheart.com. If you don't want to work in the clinic, but you want more education resources than the summit, medicinewithheart.com. We have a blog there. Lots of good free information coming out on the blog. If you do want to work with us, there's the capacity to book a call there with staff in the clinic to find out more and answer your questions.
Absolutely. I think you said it so well, right? Like it's about not just surviving, but also thriving. And that is why Dr. Miles and I work in the way that we do is like, yes, we are doctors and we work with people's health, but I like to say like the way that we work, we really like coaching people. We like to train you on kind of like how to save yourself, and then we just get to be there as your friend and confidant along the way of helping you make decisions and answering your questions when you have them. But we also believe in your ability to heal and your ability to figure it out. So reach out if you need anything. And, you know, if I treat my Instagram like a podcast. So if you like this stuff and you just want more resources, flip back through my feed. Anything with a title page is basically a podcast like this. And then I also have a ton of free education on my website, which you'll get through clicking the link in my bio through clicking here. And that's just depthwellness.com, DEPTH wellness.com. So reach out with any questions. Feel free to comment below. We will keep an eye on the comments and try our best to answer anything. The link for the summit is in the link in my bio. And we hope you have a wonderful rest of your night and get some really good sleep because it's important for your health.
Thanks, everyone. Thanks, Dr. Christine. Take care.
Thanks. You too.